You are in pain and you probably need answers. So you probably think that if you could see inside of your back, you could be able to know where the problem is and fix it. But here is the truth. Some of the most expensive scans can be able to lower your recovery and makes it slower and expensive. We live in a world where we think that a picture is worth more than 1,000 words. But in the medical field, a picture can be a real major distraction. If you scan 100 people with zero pain, probably around 50% of them will show you a bulging disc. If you get the scan early, you might end up treating the wrinkle on the inside that is not even causing the pain. Today, I'm going to settle the debate between the MRI and X-ray and explain what matters and explain why what matters isn't the real picture. It is the person, it is the patient, the client. So point number one is the X-rays, the hard facts about X-rays. So think of an X-ray like a silhouette of a building frame. X-rays are very fantastic. X-rays are very fantastic for looking for hard structures. They are cheap, they are fast, and perfect for spotting fractures, for spotting dislocations, or major arthritis. So X-rays are fantastic for looking for hard structures like bone. So if you had a sudden fall or trauma, X-ray is the first line defense to rule out a break. So point number two is the MRI, the soft detail of MRI. MRI is a high definition three-dimensional image or camera that is meant to look for soft tissues. So it sees the muscles, the nerves, the ligaments, and the spinal disc. It is used when you suspect a serious nerve pinch or soft tissues that do not heal. Unless you have red flags like leg weakness or numbness, then an MRI is usually not necessary within the first 6 weeks of back pain. Point number three is the wrinkle on the inside. This is the most important concept in modern rehabilitation. As we age, our spine change, the disc bulge, and there is wear and tear. This wear and tear appear like gray hair and wrinkles. These are normal signs of aging. Many people will see bulges in the imaging and they will stop moving, and this is what actually makes the pain worse. So your clinical symptoms, that is how you feel, actually matters 10 times more than what your imaging say. Point number four is when the scan actually matters. Imaging is a tool and not a crystal ball. A scan matters only if it will be able to change your treatment plan. So if your plan is to engage in active physical activity, then doing imaging will not be able to change your plan. Your plan will still be engaging in exercises and physical activity, and what you need is a structured program. You need scans if you get or if you have progressive neurological decline. So this means that if your leg is getting weaker by the day, or even if you have a planned surgery, that is actually the time when a scan is usually needed, usually an MRI. So have you ever had an MRI that showed something scary, but after a few weeks you felt? Share with me your comments. So to wrap it up, X-rays are meant for bones, MRIs are meant for soft tissues and nerves. Most scans will show age-related changes. Treat the movement and not the image. Don't let a piece of film